I, there it was. So Dr. Tworek is an associate professor of international history and public policy at UBC. She's jointly appointed between the Department of History and the Policy School. And her latest book is the award-winning News from Germany, The Competition to Control World Communications, 1900 to 1945, from Harvard University Press. And so she works a lot around history and public policy, around health communication. And she is joined by Yoojung Lee, who is one of our amazing undergrads at UBC, majoring in international relations and minoring in law and society. And Yoojung was part of this project that we're going to hear about today and authored the Korea piece on that report. And then after Heidi Tworek and Yoojung Lee make their presentations, our colleague Yves Tiberghien, who is a professor in political science working on comparative politics and international relations with a focus on East Asia, who also happens to serve on our executive board for the Center for Korean Research. Yves will make a few remarks at the end and also morph us into the question and answer period. So please join me in welcoming our panelists today. And again, welcome to all of you for joining.
Well, thank you so much. I'm just going to share my screen quickly so you can see our PowerPoint. This is, as you can tell by the name of my book, I am, I guess, the interloper here in many ways. So I'm really grateful to be here, but even more so grateful to Yves Tiberghien for introducing me to Yoojung Lee, who worked on the South Korea case study that we're going to talk about. And we, as she can tell you, had a tremendous time as a research team, I think demonstrating that even in times of Zoom, you can generate team spirit across the waves and that you can pull together a product fairly quickly. So the two of us are presenting today, but as you can see on this slide, there was actually a much bigger team who researched the other countries that I will only briefly mention. So I'm going to give a little bit of an overview of what we did more generally. Yoojung is going to talk about South Korea, and I'll end by just very briefly giving some comparisons to Canada, perhaps focusing on what Canada's many provinces enter a second wave could be learning from South Korea. So I've been working for a few years on the history of health communications, and of course, as COVID broke out, I was most attentive to what those who are epidemiologists and public health experts were saying about communications. Bill Gates is perhaps one of the best known, founding the Gates Foundation, also for several years now, having warned about the dangers of pandemics. In April 2020, he posted a long blog post, a Gates note, about how the world was going to get out of COVID-19. But he devoted merely one sentence to communication. It was this: it will take a lot of good communication so that people understand what the risks are and feel comfortable going back to work or school. Now, as a specialist in communications, lots of things stood out to me. People were defined as sort of undifferentiated monolithic mass. Communication seemed to be only about risk or going back rather than an integral part of pandemic responses. And finally, what on earth did good communication even mean? So Gates decided to spill one sentence on this topic. We took up the challenge to write 110 pages about it and to really delve into looking at how 9 democracies around the world had thought about communication and implemented effective communication strategies. So we took a move away from thinking about good communications. Rather, one of the crucial arguments of this report is that communications are a non-pharmaceutical intervention. So what that means is all sorts of things that we have debated endlessly, perhaps for the last 6 months. Physical distancing, masks, how large our gatherings are. Those are all non-pharmaceutical interventions, meaning things that aren't treatments or vaccines. But actually we found that communications too, effectively and clearly communicating guidelines, was also crucial. But at the same time, within democracies, communications around the pandemic intersecting with a huge number of existing crises: the rise of populism, the erosion of local journalism, anti-vaxxer activism, and so on and so forth. So what we wanted to do in this report is then to think about democratic communications. What did health communications look like in democracies? Was there something distinctive about them being democratic rather than coming from, say, authoritarian regimes? So as I said, we looked at 9 democracies around the world: South Korea, Taiwan, Germany, New Zealand, Canada, Sweden, Denmark, Norway, and Senegal. In each case, looking at original language sources to really understand what were the press releases, how were the communications infrastructures created, who were the groups being communicated with, and so on and so forth. And then within Canada itself, we looked at 2 provinces because of the federal structure of Canadian healthcare, British Columbia and Ontario. One of our most crucial findings was that you couldn't really come up with a singular playbook. So often policy reports talk about playbooks, which give you really specific directions about what you should do. But in fact, in each of these cases, we found that it was very contextual. And then instead of having a playbook, what we came up with were principles that were in fact implemented quite differently in each one of our case studies because it depended upon the conditions on the ground. For example, who citizens and civil society were, to take the P of our rapid, honestly depended on what your citizens and civil society looked like. In a place like Senegal, that involved pulling in religious leaders, for example. So we structured this report around these principles. We call them the rapid principles, in part because studies showed that one of the key ways to prevent misinformation was clear public health guidelines released rapidly, hence the rapid principles. But I won't delve into any of those. I'm now going to hand over to Yoojung to explain a little bit more how each of these really appeared on the ground in South Korea to give us a bit of a concrete sense about how this played out. So Yoojung, over to you.
So before I proceed, I want to thank Dr. Tworek for starting us off today, and thank you to Dr. King, Dr. Chirigian, and Yeonju as well for providing us with this fantastic opportunity to share our findings with everyone. So to continue, the rapid principles from the previous slide are the 5 pillars behind an effective democratic health communication. In order to facilitate understanding of these concepts, we will now take a look at how these 5 principles have shaped and underpinned South Korea's COVID communication. But before doing that, I want to set the background to South Korea's very interesting COVID story. Despite the country's proximity to the pandemic's origin and open border policy, it is one of the very few countries to have successfully flattened the curve due to its speed and innovative technology that enabled the 3 Ts. However, much of the country's success also emerged from its effective democratic communication strategy that promotes transparency, inclusiveness, and solidarity, all of which are part of the 5 rapid principles, which I will now further elaborate on. So first of all, South Korea's communication relies on civic autonomy instead of passive obedience by 1, evoking a sense of personal responsibility and social trust, and 2, encouraging active habit formation. In regard to the first point, the government has entrusted its citizens with greater autonomy by choosing to convey clear and specific hygiene measures over implementing a full lockdown. This notion of civic responsibility has repeatedly been emphasized by many top officials, such as the Minister of Health and Welfare, Park Dong-hoo, who said that if we continue to demonstrate high civic awareness, Korea will be able to attain success with social distancing. In a similar vein, the government has also advocated active habit formation. So take the culture of mask wearing as an example. Due to the traumatic experiences from past outbreaks, mask wearing has settled in as a cultural norm, perceived as a sign of consideration and modesty in South Korea. Therefore, during COVID, Koreans didn't question the possibility or validity of mask wearing, but rather embrace it as part of an effective public health response. This reflects a widespread and embedded understanding of personal hygiene, and by and large, good judgment and individual responsibility in the country. Secondly, complementing personal autonomy, South Korea's communication has sustained and built community by incorporating societal values, emotions, and stories. Adopting a division of labor approach to communicating political and scientific information, Dr. Jung Eun-kyung, the director of the Center for Disease Control and Prevention, shared primarily facts, while President Moon Jae-in spoke of sympathy, optimism, resilience, and solidarity. For example, Moon consistently reassures the public by asserting that the government will always be at the forefront in this collective effort. He also paid in communications to mental health implications of self-isolation by distributing a batch of coralwood as a pet plant to help fight Corona Blue. The packaging comes with the message, 재난 극복부터 마음 회복까지 정부가 함께합니다, which roughly translates to, the government is with you, from overcoming the disaster to healing your mind. As such, Moon strives to build solidarity and relieve anxiety. Meanwhile, counterintuitively, Dr. Jung has decided to communicate values by not communicating. She declined all media interviews, explaining that she would rather spend her time working behind the scenes. Media reports claim that she rarely slept and barely left her office. And in this regard, Jung's quiet modesty, humility, and dedication seem to have inspired trust and greater compliance amongst Koreans. However, we should keep in mind that communicating to the public as a massive, undifferentiated, monolithic society is dangerous as it increases the risk of stigmatization. So let's consider the outbreak at the Itaewon gay nightclub that took place late April. To give you some context, the LGBTQ community in South Korea prizes anonymity because of lingering prejudice. Therefore, when this group was placed under spotlight, many avoided testing for fear of being outed, which in turn endangered Korea's public health response. Therefore, health authorities introduced nationwide anonymous testing in the first week of May and reassured the LGBTQ community that it would respect their privacy as much as possible. Furthermore, to avoid scapegoating, health officials described those involved as clubgoers and framed the event as an ordinary failure of social distancing. In short, the government tried to be empathetic towards the minority group and avoided singling them out by addressing the situation more generally. Thirdly, government agencies have collaborated with civil societies to leverage their vast expertise on primarily technology. So technology has been a vital component of South Korea's pandemic response, and as a result, new public-private partnerships, mobile apps, and websites were all developed during COVID. Meanwhile, celebrities, authors, athletes, and musicians were also very much involved in public communications to 1, raise further awareness, 2, educate the public about basic hygiene guidelines, and 3, build solidarity. For example, the infamous Baby Shark jingle was reworked for this purpose. Also, a hashtag campaign was widely circulated. Hashtag 덕분에, or in other words, hashtag thanks to challenge was popularized to pay gratitude to and applaud civic engagement. And fourthly, institutional structures for communications built prior to the pandemic provided a crucial infrastructure during the pandemic. I have to say, things went really wrong back then. At the height of the MERS outbreak in 2015, South Korea's response was hampered by overlapping chains of command and unclear guidelines for interagency cooperation. This failure of communication fostered fear among the public and required fundamental legal and institutional reforms. So these reforms include, for example, 1, the KCDC gaining primary authority over infectious diseases, 2, the KCDC's director being promoted to the level of a deputy minister, and 3, the creation of the Office of Communication. Due to these revisions during COVID, communications were even more effective because channels of distribution had already been set in place. In fact, these reforms proved so valuable because not only did they empower institutions, but also helped boost compliance to health guidelines. Public compliance has been far higher during COVID than during MERS, and such institutional reforms are therefore noteworthy since they haven't been replicated in many different countries to this day. And now finally, South Korea has found new ways for their democratic institutions to operate in order to prevent the erosion of democratic rights. As the first country to hold a nationwide parliamentary election during COVID, South Korea offers lessons on how to safeguard democratic procedures. Aside the successful 2020 April parliamentary elections, which attracted the highest voter turnout of 66% in 28 years, explicit mentioning of democratic values has also been prevalent in Korea's communication. So for example, in June, President Moon framed the country's effective handling of the pandemic as a democratic achievement. He said, "In the process of overcoming the COVID-19 crisis, we have demonstrated democratic solidarity and cooperation." In a similar manner, Prime Minister Chung Se-kyun noted that Korea had turned the crisis into an opportunity for democracy to mature. Each of these leaders recognized the importance of describing COVID as a democratic challenge. The government also explicitly linked COVID prevention behaviors to democratic behaviors, reminding citizens that a successful response is dependent on their capacity to act collectively. For instance, the pandemic has been framed as a relay race to be run together, and that victory is defined not by defeating an enemy, but by crossing the finish line together. However, South Korea is obviously not without its flaws. There are certainly controversies around the country's communication strategy. First, there is the issue of contact tracing. As mentioned earlier, mobile technology is an integral component of the communication. Through emergency text messages and mobile applications, authorities have shared information collected from contact tracing. This surveillance technology has inevitably raised privacy concerns, especially during outbreaks that involved potential stigmatization, such as the Itaewon outbreak that I talked about earlier. However, there is an overwhelming political and public desire in South Korea to use it for outbreak management purposes. According to one survey, 89% of Koreans found contact tracing crucial for an effective public health response. Also, the government has sought to balance between individual privacy and public health interest, revising contact tracing practices as necessary. Therefore, this program has widely been accepted in South Korea. And moving on, there is the issue of voluntary compliance in church-linked outbreaks. In South Korea, 2 of the 3 biggest outbreaks can be traced back to faith communities. The first wave was mainly linked to the Shincheonji Church of Jesus, a secretive quasi-Christian doomsday sect with over 230,000 followers. In February, this religious group precipitated the earliest and largest cluster of infections that recorded a total of 5,214 cases. The driving force behind the spread was the church's non-compliance to the health directives. The leaders refused to disclose the name of its members, and the followers avoided testing, which altogether delayed the containment of the virus in the early stages. In response to such non-cooperation, city officials sued the church. Eventually, through reinforced social distancing measures and quarantine rules, the country was able to recover from the first eruption of the pandemic. But unfortunately, this victory was prematurely declared. Another outbreak, once more centered around a religious group, recorded an all-time high. This time, Sarangje Church, an ultra-conservative church based in Seoul, was at the core of the outbreak. In August, Pastor Jeon Gang-un and his followers congregated in a massive anti-government rally, which gave rise to a fresh wave of infections in the greater capital area. And 1 month into the outbreak now, more than 1,168 cases have been identified, and the numbers are still on the rise. Similar to Shincheonji, this church failed to comply with the health directives by refusing to test and to provide a complete list of its members. So consequently, both the pastor and his church are currently facing charges for defiance. As we can quite evidently see, history appears to be repeating itself, pitting the liberal administration of President Moon against radical sectarian religious communities. As exemplified through these 2 outbreaks, religious beliefs seem to affect the ability to cooperate with containment efforts, especially if those beliefs are perceived as incompatible with the SOP or the science. While the legitimacy of these faith groups remains a highly controversial issue in itself, these outbreaks point to a wider problem: the lack of communication between the government and religious communities in Korea. In fact, the absence of intercommunication between these 2 sectors has created a rift in the society, as witnessed through the uncompromising behaviors from both the government and religious factions. We've also found that the empathy shown towards the LGBTQ community during the Itaewon outbreak was not replicated during these religious-based outbreaks. Instead, the government responded more critically, holding the groups responsible for their non-compliant behavior. Likewise, these religious factions antagonized the government, an attitude that has severely undermined their capabilities to comply with the public health response. As you can see, this blame game goes against the 5 rapid principles and is also highly counterproductive. With that being said, now I'll pass back to Dr. Tworek, who will further elaborate on how this blame game has also been tossed around in Canada.
Thanks so much, Yoojung. So I don't want to spend too long on Canada, but merely to illustrate some ways in which some Canadian provinces have more adhered to the rapid principles, but done them quite differently, and others where it has worked out, unsurprisingly, in ways that we sort of predicted as we were looking at this report. So as you can see, looking at what's happening in Canada, even according to Prime Minister Justin Trudeau, we are entering what he called a second wave. Though that's true only for some provinces rather than others. In British Columbia, for example, we've all seen the number of cases rise, but relatively little actually change. And despite high numbers today, in general, a somewhat of a decline from the highs of a few weeks ago. In contrast, Quebec and Ontario over the last week or so have started to issue ever more guidelines in ways that seem quite confusing to people who live there in an attempt to get this under control. And one has to say that relatively little, in fact, has changed other than the decisions about what to open and the ways in which guidelines are communicated. I think pointing once again to the importance of thinking about communications as a non-pharmaceutical intervention, one of the few tools that we actually have available to us alongside opening and closing until there are more effective vaccines or treatments. So this is quite a text-heavy slide. I only want to take you through a few points before closing up. So one of the things that we did, as I mentioned at the beginning, was do a bit of a deep dive into two provinces within Canada, British Columbia versus Ontario. And the reason that I thought this was interesting to highlight today is that in many ways, British Columbia, which has had, I think, a comparatively successful approach to communications, has in many ways done it by following the rapid principles, but in a very, very different way than South Korea, mainly because British Columbia's response has not relied on technology at all. For those of you based in British Columbia, you may realize as you attempt to download the COVID app that it currently isn't switched on for British Columbia. So really, British Columbia in many ways has relied on very, very traditional tools. And yet by following these rapid principles in general has also had a very successful outcome, far more successful than we might have predicted. You may remember back in January, February, early March, the fear was that the West Coast would be worse hit. And that is, of course, not how things have worked out. So I want to call out a couple of reasons why British Columbia has been so successful. It has relied on autonomy guidelines, getting restaurants and other places to actually come up with their own solutions within the framework of those guidelines, resolutely refusing, in the case of Bonnie Henry, to blame others, to trust in the population, attending to values and emotions, sometimes telling stories, a clear division of labor. In the case of Ontario, by contrast, there has been a wide range of people communicating. I highly doubt if I asked any of you, except for perhaps Yoojung, to name who is the Chief Public Health Officer of Ontario, that you would be able to tell me, because there have been so many different people communicating. There has not been a clear division of labor, necessarily confusing and overlapping guidelines that have become increasingly granular, such that many people may be contravening them simply because they don't actually know what they're supposed to be doing. A reliance on fines, enforcement from the top, rather than trust in a population to do the right thing. It's not by accident that Dr. Bonnie Henry actually has been the most cited woman in Canadian media basically every month since March, as we know from someone called Dr. Tworek, who runs a gender tracker of Canadian media. It is because she communicates in ways that combine clear guidelines with empathy, with attending to emotions. Even the classic slogan, be kind, be calm, be safe, is about emotions, and yet is communicated through the very traditional methods of press conferences. Citizens and civil society have pulled in their ability to actually control this. We've seen as the pandemic has gone on, though, the weaknesses of this in the ability to reach young people, leading to more attempts to think about social media. Communications are less institutionalized in the sense that there's less obvious capacity, like a communications unit. There are still people who do attend to it. And then finally, the D of democracy is the last bit that I wanted to highlight, because it's also a very clear contrast between BC and Ontario. We've seen in BC a resolute rejection, like in South Korea, of using any military metaphors. We have descriptions that are of natural or environmental, talking about caught in a storm, viral waves, hurricanes even, things that are natural, environmental, that perhaps we can control in some way. By contrast, Ontario has often talked about it in terms of militaristic metaphors, a conflict, talking about combating or fighting an enemy, something that we find in the report is in fact counterproductive because it implies these top-down, more authoritarian guidelines. But if those guidelines are themselves unclear and constantly changing, this can result in all sorts of problems, which unfortunately we are seeing come to the fore over the last few weeks, and I fear will continue unless communications strategy is dramatically rethought. But this case of Canada, particularly BC, I think reminds us that technology actually is not the determining factor, unlike what many people might think about communications. It's really about the sorts of principles that we talked about, which could be implemented through a highly technological solution in the case of South Korea, but in the case of BC, can actually be low tech and still function. So just a couple of conclusions. One is that this report is very different in tone than probably pretty much everything else you've read about information, which has focused on the infodemic, conspiracy theories about Bill Gates wanting to vaccinate so he can, I believe in this case, implant chips in people to follow them around. This has been the focus, including of the World Health Organization itself. By contrast, what we found is that putting out reliable information using these rapid principles could actually forestall disinformation. We found the same in Taiwan as South Korea. So in conclusion, and thinking about sort of academic merits of this, it pushes us to learn from other democracies, to be humble, as even the Deputy Chief Medical Officer Howard New said earlier today. Secondly, to take an interdisciplinary approach, learn from other disciplines, whether it's sociology, public health, epidemiology, communications and media studies, history, political science. And finally, Bill Gates was wrong. It is not good communications you need, but rather clear, consistent, compassionate, commensurate, constructive, and contextual communication. So I will end there, and we thank you both very much and look forward to hearing your questions and thoughts.
So I guess I will pick up from there. So yeah, thank you, Heidi and Yoojung, for a fascinating talk. Very, very stimulating, interesting. You really get a new focus on COVID. Which finally gets us off President Trump and all the questions of pure state capacity and all this, but you focus on the communication and the empowerment of individual, the participation and the building of civic values, basically turn this lemon of COVID into a chance to reinforce democracy when it's done properly, which is very, very inspiring, and there's a lot to learn from. I think one of the themes that you have in both Korea and BC, to some extent, is the non-politicization. That is, there's a heavy reliance. On one hand, so it's an interesting, there's that division of labor between the science part of the communication and then the social, civic side of the communication. In BC, some of the civic, social side happens with Bonnie Henry as well. In Korea, it's much more divided in a very two-track. But so there's those two kinds, but in both cases, we see that's not been politicized. And that contrasts heavily with cases that are well known, like the UK or the US, even to some extent France, where there has been all that heavy politicization. And what's fascinating too is what you find here with Korea on this is actually quite general across Asia. So there are scholars writing that there's an Asian model of dealing with this pandemic. With some exception, I've seen among all the comparison on Indonesia, which is a bit more of a laggard. And of course, when you get to India, there's other aspects. But we find, in fact, elements of the model in places like Vietnam, of course, Singapore, that of course have a heavy stick as well of the state, but they actually have used some of the same methods. And some of the reliance on civic values as well, and clear information, as well as the heavy state. So there's a big story there. But so now I just have 3 questions to get you going while everybody is building their reservoir of questions. So for everyone else, please prepare questions. Great chance to ask me things. The first one is how much of this whole effective management of COVID, including the communication piece, depend on having strong state capacity in the first place? That is, if you don't have the state capacity, and in the case of BC, it would be the healthcare system, right? So there's an element of a rock there, something that works, that's institutionalized, and we can, I guess, we have solid government structure. In Korea, it's even bigger. We have a very organized state capacity. We find the same thing in Taiwan, find the same thing in across Asian countries, actually, and even in Japan. So how much does it matter, right? And if you don't have that, if you have a fragmented structure before even it starts, whatever communication you do, you're just going to run after. I mean, the thing is running faster than you. So they seem to be a combo here between the minimum state capacity, which sometimes can happen more easily in developmental states that we have in Asia, but can happen also in many states like Germany or others. The second question is, maybe we'd love to hear more on privacy, because it's the biggest differentiator, I guess, between Korea and Taiwan, for that matter, and which, by the way, did relatively similar to Vietnam or to even China, and BC, where we don't have the app, indeed, or Canada or the US, it seems that at the base, from what Yoojung said, there is maybe a culture norm here, that we're divulging a bit more privacy is accepted from the get-go. And right from the get-go, you're going to have a much more effective response, right? Because if you can do effective contact tracing from the beginning, and you can even show where it is, etc. Even that meant, I know in the earlier months, for those who don't know, there was the ability for outsiders to know quite a lot of things about the private life of individuals that had been tested positive. And for those who tested positive, they did not have an opt-out option, right? Their information was, without the name and all this, but still the location was going to be revealed on the website, and people, would compare different location and find that people were together that shouldn't be together at the same time. I mean, you could find quite a lot. So there seemed to be a cultural acceptance here, which has enabled Korea or Taiwan to be much more effective and rapid, but is absent. So they seem to be absent in Europe or US in general, and Canada. So they seem to be, some people call it the Confucian norms. So there's a culture difference here. And it comes with a big cost, a potential cost, if the data is not either destroyed afterwards or gets to be hacked or gets to be misused. But I don't know if there's any further thoughts on this. And then finally, communication and vaccine. Today there was a poll from Angus Reid in Canada that showed that, first of all, 16% of Canadians are absolutely opposed to taking the vaccine. 16. 39% don't want to rush into it. People take it and they're fine. 7% are indifferent, and only 36% are ready to take it when it's available. So and it's gone down over time. The number, was 45 or 50% 2 months ago. So is something, and I'm curious what it is in Korea. Is there readiness to rush in and get the vaccines when it's available? But what's causing this drop in trust in the vaccines in Canada? And is there something particular here about communication related to vaccine? For Canada, maybe is it related to Trump, who is rushing the approval and is not following the normal process? Or are we fully autonomous here? How much for us is leaking from the US? But there's a particular puzzle here. Canada is a health leading nation. Has been a leader in vaccine development. There's always been trust in vaccines. So what's going on here? So thank you very much. Maybe we'll turn first to Heidi and Yoojung to address those questions, and then I will keep gathering Q&A. Mm-hmm.
Yeah, sounds good. So I'll take a first stab at the kind of broader set of these, and then I'll hand over to Yoojung to maybe talk particularly about privacy and maybe if she knows anything about Korean attitudes towards the vaccine. So this question of state capacity, it's fascinating, right? Because there was a global health security index late in 2019 that ranked all countries by their pandemic preparedness. And, US was number 1, UK was number 2, and that was very much an index based on, amongst other things, state capacity to respond to epidemics or all sorts of different blah, blah, blah factors that went in. And it turned out it was not at all predictive. And I think it's one of the reasons also why we looked at places like Senegal, which if you were looking in classic terms, at public health state capacity, doesn't have huge capacity. I was doing an event earlier today with someone who's a WHO regional emergencies director in Africa, and he was reminding us there were 2 labs at the beginning, one in Senegal and one in South Africa, in all of Africa that could process COVID-19 tests, right? So the beginning capacity was not high, and yet the response in Senegal has been very impressive. So what's weird is that it's not just state capacity, it overlaps with the politicization, the rapidity, and a whole host of other factors, which is part of what makes, I guess, for us academics, COVID-19 sort of endlessly fascinating, because it then also dovetails with these other bigger political science questions about democracies versus less democratic states, socialist states. You know, Cuba has done extremely well and has always prided itself on very high levels of public health capacity. And that was a very low level technological response of doctors knocking on doors. And that too, like in Vietnam, has been very successful. So a kind of next state of this research would be, instead of taking a cut that looks at democracies, one could look at Vietnam, Cuba, etc., and see what are the other bits of communication if we're going to keep looking at communication. But I would say that one of the things that I found interesting is that state capacity has not been as predictive as we might have imagined. It has had to do with so many other factors, and some of this communication didn't require very much money at all. It required the right civil society groups, etc., etc. I won't say too much about privacy. I'll let Yoojung take that. The vaccine, yes, I have been like moaning on about this problem for a very long time, because the anti-vaxxer networks have been there for a long time on social media. This has already been a tremendous problem, even amongst a small group of people in Canada, but we've seen it become increasingly complicated over the course of this pandemic, as it has dovetailed with a whole host of other conspiracy theories. And I would say that that in turn has dovetailed with, and I would say that even from the beginning was not just a far right problem, it was a far left problem too. There were fewer people vaccinating their kids in LA than in any country in Africa. And that was because of left-wing beliefs, not right-wing beliefs. So I think a lot of what is happening is it's a confluence of fear of the politicization in the US, overlaid with other anti-vaxxer sentiments, overlaid with a broader environment in which even within Canada, there could be, I think, some improvements in pushing out information. And I'd say the final thing that concerns me about vaccines is the unintentional portrayal of them as a silver bullet. Most vaccines, they're not 100% effective, right? We're talking 50, 60% effective. It will only slow down transmission potentially, or it will mean that if you catch the disease, they will be less virulent. So I think this is part of the problem, is even a misunderstanding of what the vaccine does, because some of the unintentional portrayal was, we'll get a vaccine, everyone will get it, and then we'll be fine. So let alone talking about logistical challenges, etc. I wonder how much of what is happening, though I can't prove it, is a deeper understanding that the vaccine isn't the be all and end all anyway. And so a reluctance to take it. Yoojung, why don't you take the privacy question? Anything else you want to add before we delve into the questions from the audience?
Yeah, so I kind of wanted to just talk about how I agree with Dr. Tworek about the notion of the cultural factors weighing in and accepting contact tracing in Korea. And definitely, as one of the questions have been addressed, I do think that like the Korean strict surveillance monitoring system would be more controversial in individualistic culture, such as like North America. But from the research that I've done, I do think that the reason why contact tracing has been more accepted is the traumas from the past experiences. I do believe that has been the biggest reason behind this wide acceptance of contact tracing, just because of how the failed attempts of containing the MERS outbreak with the impeached ex-president, that kind of left a huge mark on the Korean society's and the public's impression of how the government can monitor and control the virus. So I do believe that those past experiences have served as the prime reason behind the wide acceptance of contact tracing in Korea.
Anything on the vaccine?
So, I mean, please jump in if you have more information regarding the Koreans' opinions on vaccination, but my understanding has been that because of this, again, going back to this idea of like clear division of labor, of like delivering facts, and the politician being in charge of conveying sympathy and optimism, all those values, the general public's understanding of vaccination has not been meddled by other superstitions or controversial information, and it hasn't been used as a political weapon to like, this goes back to the same issue of like mask wearing and all vaccination. They haven't been politicized, and because of that, I do think that there are less anti-vaxxers in Korea, but please do correct me if I'm wrong. I may be unaware of some statistic that is out there, but yeah, that is how I see the situation.
Great. Yeah. Thank you. Thank you so much. This is great, Yoojung. So I have we have now 4 or 5 questions. So for now, we'll take them one by one in order because we have time, and rather than make it a big bunch. But if we start with time at the end, I will we'll start to bundle them. So here is the first question. Do you think that there will be a playbook that could be developed from COVID-19 that can be used more consistently across countries for future viruses of this type? Or still, will it be principles based and every country will take their own approach? But of course, with the team that Heidi has developed, we're likely to have a playbook, a flexible, smart playbook.
Yeah, you know, it's a great question, but I think it's one of the key things that we find is that actually that contextual flexibility is really crucial. And maybe, you know, I can just name one sort of obvious reason why. South Korea, what, 97% of people have an internet connection. In the US, 42 million Americans lack access to broadband. So we're just talking even on an infrastructural level, how you deliver information has got to be radically different if you are at all attentive to your population. So that's part of why we went with this principles-based approach, because in fact, the context remains so radically different. So I guess maybe the other thing that I would say though, is that some of we've taken these principles in a new direction, but it's not like health communicators did not exist before. And one of the tragedies of the US is that the Center for Disease Control did actually have a chapter in its sort of epidemic management handbook, which was about communication. So we take this a few steps further than what they did, but many of the ideas around conveying emotions already existed on some level. So part of the tragedy has been places like the US where they've often not been implemented. We've taken it, as I said, multiple steps further, in particularly how we look at citizens and civil society and democratic descriptions. But I think this is really an attempt to push that forward. And the other thing that I would say is that many of the countries that were successful, they actually did learn from previous viruses. So in the case of South Korea, it's MERS. With Taiwan, it's SARS. With Senegal, it's Ebola. With New Zealand, fascinatingly, it's actually the 1918-19 flu pandemic, where a history book about that formed the basis of how they created their pandemic preparedness plan. So in many of the countries that have had a good response, they actually took very seriously how to reform their structures on the basis of past experiences. So my hope is that it remains principles and context-based, because I worry that something that isn't will actually do a disservice.
And if I can just add, while the report did limit the scope of investigation to democratic countries, I do think there are values that can be learned by the so-called non-democratic countries as well, although obviously its application may look different. So also more than the values themselves, I do think that non-democratic, democratic countries alike can learn more about the nature of the virus and the type of conflicts it can bring to the foreground. So for example, in the case of South Korea, it's been the issue of religion. So while the application and procedures that follow may be different in each country, the lessons from looking at these countries in our report are definitely significant and should be considered also in the non-democratic countries.
Excellent. This is great. All right. So here comes the second question. It feels like in those TV shows when you open an envelope and here comes the question. What is think about how cultural context might moderate the effectiveness of different communication styles? For example, would Korean strict surveillance and monitoring system work in more individualistic culture that emphasizes autonomy, such as North America? So I think we have covered that, but if you want to add anything else, you're welcome.
Maybe I just say that actually health communicators have adopted very different styles depending on the country they're in. And that we see as, again, the principles-based model lets you account for that.
Right. Okay, and I think Yoojung covered that earlier, right? The next question, could I hear more about pro-self versus pro-social framing? What would be the example of yes, there's a typo here, pro-self framing or pro-social, and would there be cases where it would work better?
Yeah, it's a great question. So pro-self means portraying in such a way that it benefits you. So wear a mask to protect yourself. Pro-social would be to protect others, so wear a mask to protect your community. So in some experiments that have been done, so big, through Amazon Turk experiments, using these different framings, mainly been done in the US, to see does pro-self or pro-social work better. So you would think in the US, right, you would assume it would be the pro-self, but in fact, even there, the pro-social framing actually worked better. Now, in some cases, you see them being combined, right? Wear a mask to protect yourself and others. So sometimes they do get combined. Obviously, any of these sort of experiments never find 100% compliance rate for either of these framings. So it's going to depend on who is the group of people. Are young men going to respond differently to a certain framing than people who have children, for example, or someone who lives with their grandmother may respond differently than somebody who lives alone. So it's just that in general, experiments find that pro-social is somewhat more effective, but I think there are cases in which pro-self could be useful, and that's part of not treating the public as a monolith, is trying to sort of delve into which of those work. But I would say relentlessly pro-self, as we saw in places like Ontario initially, did seem to be less effective than having pro-social. The final thing I'll say is who you imagine as your community is often left undefined in these experiments. So that's another area to kind of delve into. Who do people actually see as their community?
Yeah, this is great. That makes me think of I live on a small island community. And initially people were not wearing masks and were discounting it when it was, for self. But at some point there was a bunch of things. The post office manager, who's a very, very social and very popular person, said, I have asthma. If you guys don't come with masks, we're going to get sick and you'll have no more. The post office, also the gas station, is everything, right? So there'll be no more gas and no more post office working. I want masks in the post. Everybody followed that for her, right? It was done for her. And then the next point was, we have a lot of elderly and there's no healthcare on the island. So elderly could really die. And so suddenly everybody's wearing masks because it's for those people. And so overnight, that kind of more individualistic pioneer culture out here became, caring for others. And I think it's an interesting transformation that we hadn't seen yet. All right, so I have another question now. I think it's a very, very interesting one. How do we understand public shaming of building civic responsibilities? And that person says, I read an article that Koreans fear more about being othered than actually getting the virus. Be too much focus on civic duties generates such side effect. And I will add to this the case of Japan. So Japan is the odd case because they did everything wrong on paper, pretty bad, organized, no good central command, bad communication, but they have very low death rate and very low, the outcomes are pretty good. And essentially what we find in Japan is everybody's wearing masks. In fact, Japan pioneered mask wearing back in the 50s before everybody else. And number two, there's a lot of shaming in a society, especially if you don't have a mask. But so it seems to be a social level protection that saved Japan rather than government. But so I'm curious here, what do you think of it? Mm-hmm.
We appear to have briefly lost Yoojung, so I shall take this one. I mean, this is, I think, a fascinating question because I don't think it just applies to Korea. I think it actually applies to a huge number of places. For example, Canada or the UK, where increased cases have been blamed on young people, that you now have multiple issues of will young people actually go and get tested? Will they feel shamed? And this can actually have a tremendous spiral effect, right? Where you can actually end up with the disease spreading because people fear being shamed, which is one of the reasons why we suggest pushing against the blame game and trying to find a way to balance that. So you can see how shaming in the case of Japan leads to a cultural norm that actually ended up being incredibly important in this pandemic. And maybe Japan also got lucky and had no super spreader event, because we seem to find now in the literature that actually the most important thing is, did you get unlucky and get a couple of super spreader people, rather than just a sort of general dispersion rate. So that's called the K rate rather than the now very well known R rate. So that kind of thing is also a little bit of luck potentially in the Japanese case. So I'd say that public shaming in general in the other cases that we saw can be quite problematic. And maybe the churches are a good example of that. In South Korea, they can create some pushback, a distrust of working with authorities, and also potentially not even testing yourself in the first place.
Yeah, and we don't have Yoojung anymore. Yeah, you're right. She disappeared right now. So
I think she's back. I think you just need to make her a host again if you can, Yoojung.
I see. Yes.
Move on to the next question.
Yes, I will do.
All right. So Yoojung, if you're back,
I'm so sorry. It was the internet connection that just kind of.
Yeah. So did you hear the question on public shaming, the role of public shaming in the context of building civic responsibilities, and the fact that Koreans supposedly fear more about being othered, ostracized, than actually getting the virus? Any thoughts that you have on this?
Yeah, I mean, as mentioned in the report, like that separating that, making some othering another group, and that effect has been counterproductive. And obviously we've seen cases with the religious-based outbreaks where the government has kind of condemned those religious groups and those groups have been othered. And obviously that haven't been that hasn't yielded great outcomes. And in regards to being othered, I agree that within Korea it hasn't been an effective method. And although I do understand the frustrations of these outbreaks resurfacing, and especially if they're based around specific religious communities, then that hatred towards Christianity, just because they're both related to Christianity, Christianity in general has not been great. So I do think that it has very negative effects, and I don't think it's more of a side effect though. I do think it has to do with the, again, lack of intercommunication between these religious communities and government, and that the consequence is discrimination and stigmatization of those religious communities. But I do think that points to a wider societal problem, and it's not so much as a side effect of what the question asked.
All right, excellent. So the next question, we have a lot of questions. Actually, we have 5 or 6 more now. Are we okay until 15 or 30 past? Ross, I'm looking at Ross. He's shaking. What's our official end time here? We're having a good time, so we're learning a lot.
I wouldn't want to go 10 past 6.
All right, okay, so anyway, we'll keep going as fast as we can. So next question, would you recommend more intentional communication to specific target groups, such as youth, where we had a popular actor like Ryan Reynolds send a message to people, or K-pop stars speaking to youth in Korea? How do you identify which segments of the population require more tailored communication?
Yeah, so very quick. I mean, Ryan Reynolds, obviously the hilarious thing was at some point when, NDP Premier John Horgan asks Ryan Reynolds to do a message, he did one, but he said, I'm a bit older than your target demographic. I mean, he's not so young anymore. And here we're talking, I mean, honestly, I believe in empowering young people. I believe in empowering people who actually know how to use TikTok, which I just don't, even though I'm not so separated from them in age. So I think there's a lot to do with that P of pulling in citizens and civil society, right? That it doesn't just have to be tracing apps. It can be bringing young people in to decide how they want to communicate these messages, with some obviously like public health guidelines to look and make sure that the messages are actually in some way responsible. And then which segments of the population require more tailored communication? It relies on moving beyond thinking about an idea of a general public. Which is very problematic, because if you don't belong to the group that's being designated as the general public, you might feel very alienated. So for example, I remember in initial Canadian briefings by Justin Trudeau, he would talk a lot about people's cottage or their cabin. And I thought, what is this cottage cabin thing? Does every Canadian have a second home, right? So it's actually a way in which this is sort of very, very much aimed at a middle class, particular type of Canadian, which I didn't necessarily feel myself to be part of. You can imagine many others feeling the same way. So any good communication strategy actually is already thinking about how you reach a diverse population, but what the diversity of your population is looks very different. In the case of South Korea, maybe Yoojung, you want to talk about the role of age, for example, being tremendously important.
Yeah, so within South Korea, in terms of communications, I kind of briefly touched upon this earlier in the presentation, but there have been different age-targeted content made by, whether those are celebrities or the the popular individuals. And like, for example, that Baby Shark jingle that I was talking about earlier was mainly targeted obviously for younger children, whereas something like the hashtag campaign is more targeted towards people of my age. And I found that especially for in terms of reaching out to people of my age, it's been more effective in just trying to build that resilience and sympathy rather than educating, just because, as Dr. Tworek mentioned earlier, there's a high digital literacy rate in South Korea. And because of that, generally people my age are aware of what the health guidelines are and what they need to do and to protect themselves and the community. So I think the problem now is more to build resilience and build that sense of community. And in terms of that, those celebrities and all those hashtag campaigns have been very effective in doing so.
Excellent. Great. So we have a few more that are including some great questions here. So one is, what is the basis of conservative Korean religious groups' defiance and non-compliance? Is it just opposition to the Moon regime, or do they have religious reasons? Is it coming from the Bible that they should fight? I'm adding this, right?
So
yeah.
these two religious outbreaks, although they may look similar, they're very different, in fact. The first one related to Shincheonji, the reason why they defied the protocols is because of it goes directly against the standard operating procedure and the signs. So the nature of that religious group is they have to congregate in a huge mass in a very confined space, and that's how they deliver their services. So because that goes directly against the health protocols where you're supposed to socially distant, that's why they defied, according to our point of view, they defied the public health protocol. But in this case, the most recent outbreak related to Sarangjila Church was more of a case of political defiance, I would say, because Pastor Jun and his church is notorious for going against the Moon's liberal administration, and this has been even going far before the COVID. During the ex-president's impeachment, he forced his followers to oppose those policies, and if they didn't, then he said he threatened to delete their names erase their names from the Book of Life, I believe. And as such, like, there is definitely a political nature involved in the most recent outbreak, and that is the prime reason behind the most recent cluster of infections, because they gathered in that anti-government rally, and that's how it spread.
Excellent. We then have a fascinating question from Sun Young Park, who actually is a PhD student here. She went back to Korea, voted in the election. She could also share how it was in the parliamentary election, then came back and has experienced quarantine on both sides. So she has a comparative quarantine question. And her experience looking at this, one of the biggest differences was not only the technology each government used, but the amount of penalty each government would impose for those who violate self-isolation duties. Korea, the penalty was only $3,000, which is already hefty. But in Canada, on paper, is as much as $750,000. A general public sentiment was that the government should raise the penalty much higher than the current level in Korea, but it hasn't happened. Left me with an impression that although the Korean government is tracking the locations of all those who were exposed or got tested, and is asking them to stay at home, even by using the credit card usage record to detect those who are hidden, the government actually has less enforcement power than, say, Canada. So what can we say from the Canadian hefty fine in terms of government enforcement capability relative to Korea?
That's a fascinating question. Maybe I'll take
excuse me, may I add a little bit more? Yeah, it's my expression. And by the way, thank you for the presentation. Well, my impression was that maybe the Korean government or some other East Asian government have some very strong government, like a big government, while the Canadian is really soft and they respect people's autonomy and such thing. But if you look into the enforcement power, well, I think things could be opposite. So that's my might kind of take away from my experience. So yeah, how about the Canadian government just in terms of the enforcement thing?
Yeah, it's a great question. I think part of it relates to which part of the Canadian government you're talking about, right? So the Korean system is more centralized, whereas in Canada, the federal government is responsible for borders, right? So it's the Public Health Agency of Canada in consultation with Health Canada that controls the borders. So that means that, for example, BC and Ontario don't control borders. So the fines that you're talking about, they come from the federal level, not the BC and Ontario provincial level that I've been describing. So it's actually, in that sense, a very interesting system, because if you get it wrong, you can also have overlapping, contradicting communication, and also contradicting approaches, right? Because we've seen in BC that although there are fines, Bonnie Henry is actually quite reluctant to implement any of them. And those who have been pushing for more fines rather came from the political side, like public safety minister, et cetera, et cetera. So I think when we talk about the enforcement level of those, that's coming from the federal level. And maybe the final thing that I'll say is I wonder, and this is my hypothesis, how far this also has to do with an inability to trace, right? So in South Korea, if you can see, oh, well, this person has just used their credit card, okay, you can slap them with a fine, but people know they're being tracked in a certain way. Whereas in Canada, the enforcement, and you would know better than I, having gone through it, it doesn't have that level of ability to track. It relies on ringing you up and so on and so forth. A bit of an honor system, but I think the larger fine behind it is perhaps because of the lack of state capacity or the lack of willingness to accept that intrusion into your privacy. So that would be my hypothesis, but I think the key differential there is that there we're talking about the federal government, which is sometimes taking a slightly different approach than the provinces, and that's some of the problems in Canada are trying to figure out how you coordinate between the provinces, which often have very different approaches, versus what the federal government might like to do. Yoojung, do you want to add anything else about the Korean case?
When we're talking about like how stringent these policies are, I think immediately that came to my mind was that argument often made in Korea and elsewhere that like, do you think Korea could have contained the virus more easily if it closed its border and had stricter policies, which has been a constant debate in Korea as well. And in regards to that, I feel that South Korea's success hasn't been dependent on the extent to which the border was open or the extent to which how stringent the policies are regarding to fines. And because of that, it's rather dependent on like the robust institutions combined with like the effective communications that underpin the country's success. So it's also important to think about how the three major outbreaks that took place in Korea were all due to internal cases rather than externally like imported cases. So I do think that that's why the South Korean government might have implemented a less stringent a fine policy regarding breaking that self-isolation period because it relies more on its institutional powers, and they realize that it's not really a problem of imported cases, but more so of internal.
Finally, I'm going to turn to Dr. Kyung-Hae Park. She's going to make a comment directly. She also just returned from Korea and therefore went back and forth through the, through the two systems. Kyung-Hae, are you ready?
Okay, let me, do you hear me?
Yes.
Oh, okay, great. I'm actually in quarantine right now for 10 days, and I was in Seoul until last week. And I just want to share some of my experience. In terms of frequency of communication, in Seoul, I was exempted from the 2-week quarantine, but despite all that, I had to do a self-check every day and for 2 weeks, and also they called me every day for 2 weeks. And then so many messages, the text messages, which interrupted our phone conversation and phone calls and all that. When I got back last week to Canada, I just got one phone call. So, you know, the contrast between the frequency of communication. And also, in terms of privacy, the Yoojung mentioned, and then also the contact tracing acceptance. I definitely think it's part of culture, and then also based on past experience on different virus diseases. But what surprised me was every time we go to a restaurant or a coffee shop, we had to do QR code. right? I was very surprised that every single time, we had to do this QR code, scan the QR code, or write down your contact number and all that. So I asked my colleagues there, so does that bother you? They said, no, it doesn't bother us at all. And then they explained why. Also, it's cultural and then past experience, but also they mentioned the population density. They think that the density of population in Korea is totally different from North America. And so they think the Korean model should be different from North American model. Everybody seems to accept all this, the contact tracing activities, and then nobody seems to be bothered by that. So that really surprised me. So privacy concern, they don't have as much in Korea. Just to share with you.
Wonderful. Heidi, Yoojung, you want to reply or comment on this?
It's good to hear experiences. I mean, it's very helpful to hear that people who are on the ground confirm some of the things that we've found while researching. And I think I would only add that, this has been one of the many interesting debates, is this question of city density, which seems to have no correlation with the number of cases, in part because places like Hong Kong or Seoul, people there were so aware of that as a factor that they were likelier to comply with mask wearing and for a whole host of the other reasons just described. So it's one of the many interesting / confounding elements of COVID-19.
Yeah, terrific. So I guess we're reaching the time appointed by our great fearless leader. And we don't want to keep everybody too long on Zoom, because according to Bonnie Henry as well, we need to, and others, health specialists, we shouldn't stay on Zoom more than 1 hour at a time. And then you have to do a bit of exercise break and do all kind of things. But first of all, I want to thank Heidi and Yoojung for a fascinating talk. You put a lot of content here in a very short time, and it was delivered brilliantly. It's a wonderful team as well between faculty and students. It's a great model for everyone, and also a great model in terms of combining a theoretical framework based on comparative cases and in-depth knowledge of a particular case. So this is really best research and very, very good policy engagement. We've learned a lot about the importance of communication in fighting COVID and pandemics, and probably this can apply to many things like climate change. So maybe your future project will be communication and climate change, which will roast all of us based on the smoke that's still above us right now within a decade or so. So we're gonna have to ramp up our game here. And we've learned a lot about the different components of how effective communication can work, and what we can learn from Korea, which has been a very, very interesting pioneer case. Something we haven't discussed is beyond communication, but they were also the fastest of the bats in having a test developed, because they had the whole infrastructure developed from MERS, and within January they were going right away with testing, whereas the US was still discussing and arguing about testing. So there's so much to learn from Korea, and communication has been one of those great features. So thank you on behalf of the Center, CKR, and the SPPGA. Also, thank you to the audience. You have been fabulous, amazing questions, and it's really a great group. So, and thank you for Sun and Kyunghae for those additional comments.
Thank you, everybody, and thank you, Yeonju, for managing everything from behind the scenes. Thanks, Heidi. That was great. Thanks, Yoojung. Have a good weekend, everybody.
Thank you for coming.
Thank you, Yeonju. That was amazing. Yeah. Great work.